To the jurors and everybody else, thank you for your patience. Mr. Chernoff.
Cherilyn Lee, Judge.
Thank you.
Miss Lee, would you please stand in the witness box? Please raise your right hand. Do you solemnly state that the testimony you may give in the cause now pending before this court shall be the truth, the whole truth, and nothing but the truth, so help you God?
Yes.
Please be seated. Please state your name for the record. Spell your first and last names.
First name is Cherilyn, Cherilyn. Last name is Lee, Lee.
Ms. Lee, good afternoon. Let me provide you with some instructions, which I give to every witness in every case.
Yes.
The first, please sit back and relax. The second, please speak loudly so we can hear you. The third, please answer a question yes or no if called upon rather than using slang. And the last, please wait until you hear an entire question before you even start to answer it, even though you may think you know what the question asks. Is that all acceptable?
Yes.
Thank you.
Thank you.
Direct, Mr. Chernoff.
Thank you, Judge.
You're welcome.
Miss Lee,
Yes.
what do you do for a living?
I am a holistic practitioner. I'm a nurse practitioner. And what I do, I have a integrated clinic where I see people and treat them on a nutritional basis.
What is a nurse practitioner, Miss Lee?
A nurse practitioner is basically you have to be an RN first, and then you become, after further education, you become a nurse practitioner.
What would be the difference in what a nurse practitioner would do than an RN?
Well, a nurse practitioner, things are sort of changing a lot in that field now, but nurse practitioners can run and operate a clinic. I do have a medical director, so we can open and operate a clinic. And mine is basically just nutrition and dealing with natural remedies and supplements.
How long have you been doing that?
Off and on for about, I guess, 15, 20 years.
Okay. And you've actually helped quite a few people during that time, haven't you?
Most definitely.
Yeah. And you work with sports people?
Exactly.
Yes. And entertainers?
Yes.
Yes. Legally, can a nurse practitioner prescribe medications?
Legally, a nurse practitioner can. I choose not to because I don't like what medication does to people, and there's usually a natural remedy for it.
How is it that a nurse practitioner can do that without a medical license? What is your understanding of your...
I am board certified.
Do you have to associate with a doctor to do that?
As a nurse practitioner?
Yes.
No.
Okay. What are the limitations in the medicines that you're able to prescribe? I mean, if you had chose to, of course. But what are the limitations?
In honesty, I don't even investigate them because I don't choose to give medication.
You have prescribed medication in the past, right?
Well, yes.
Antibiotics, for instance?
Antibiotics?
But other than controlled substances, are you able to prescribe?
No, absolutely not.
Well, that's a good question.
It's sort of a bad
may not
question.
get the answer.
Yeah.
Go ahead.
You are not allowed to prescribe controlled substances, right?
No.
Okay.
So that's correct. You're not allowed?
I'm not allowed to.
Okay.
Correct.
But other medicines you're allowed to?
Yes.
All right. During your period of time with this clinic as a nurse practitioner, and I'm going to focus on the clinic, but during this period of time that you have been running this clinic, did you have occasion to meet Michael Jackson? Did you meet Michael Jackson?
Yes, I did meet him, yes.
Okay.
Not in the clinic, but
Okay.
yes.
Where did you meet him?
I met him at his home.
How is it that you were wound up being at his home?
Well, I had a call from a dear friend of mine. Her son is one of the security for Michael Jackson.
Who
And
was it that called you?
Fahim,
Fahim Muhammad?
yes.
Okay.
May I have some water, please?
Absolutely. You want to wait a moment, or are you okay to continue?
I'd like to wait a moment and have some water.
Sure. Okay. Could we please, Mrs. Benson?
Can I bring a cup? Or do you-
We have our own.
Okay. All right.
Give us a moment.
Thank you.
You're welcome.
May I sit down, Judge, then, while we wait? I also...
I was going to say, if you
Need
sit down,
something
you
to
can't
drink.
talk because we can't hear you. So that's the trade-off, you should turn off.
Deal.
Mrs. Benson, Deputy Jones, thank you.
Thank you very much.
You tell us when you're ready, Ms. Lee.
I'm ready. I just need to wet my throat.
Mr. Chernoff.
Thank you, Judge.
Thank you.
Fahim Muhammad, you said, called you?
Yes, Fahim Muhammad.
How long have you known Fahim Muhammad?
I've been knowing him for greater, I know, than 5 years. His mother's a dear friend.
Okay. And what is it that, what did Fahim Muhammad tell you that caused you to act to come to the house?
Fahim Muhammad gave me a call, and he said that Michael's children had a slight cold, and could I come to the home to see them? And I said, well, keep in mind, I'm not a pediatrician, and I'm not a physician. So he said, no, he's aware of that. I told him who you were, how you have helped so many people in the community. And he gave him a little bit about my background and the things I have done as far as health care. And so that's how I met him. And then I set an appointment, and I went to the home to see the children, and Michael was there. Mr. Jackson was there.
Could you tell us what date this was?
I can tell you it was the latter part of January of 2009.
Would your medical records help you
Yes,
remember?
and I did bring a copy of my records, and they do reflect everything that I've done. It's been noted and charted.
Okay. Well, do you have a copy of it?
Yes, I do.
Will you please tell us when you received this call?
I left it in my bag, if I can get it from my bag.
Judge, may she?
You may, please.
Thank you.
Well, we can get it to you. Oh, I thought you had it there.
I'm sorry.
It's in the back? No, we'll bring it to you.
Oh, I'm sorry.
That's okay.
I didn't want to
Be
put
sorry.
anybody to any extra work.
Thank you. Is that it?
Yes. Thank you for your patience.
The question is?
The date that you were called out to the house.
January. Well, can we go to the next question and I find it?
Okay.
Oh, thank you.
How were the kids? Did they have a cold?
The kids that have,
Excuse me, I don't know if we got to the date.
No, she wanted me to go on.
Well, that's up to you.
Well,
I have the date of when I first started seeing Mr. Jackson. The date I was at the home, I think it was had to be the last date in January. Because I saw him, because I went back.
Okay, so
Yeah.
January 2009?
Yes,
Okay, that's close enough.
yes.
So you went out to the house.
Yes.
Did you make an appointment, or did you go that very day?
Made an appointment, because
Okay.
Mr. Jackson would definitely want an appointment made. So an
Well-
appointment was made for me,
Okay.
and
Well,
I did go to the home. Yes.
So you made an appointment to go see the children?
The children, yes.
Yes, okay. Was it the next day? Was it 2 days later?
It was actually it was the same day, because he said they had a cold and he wanted someone to see them right away, so.
All right. And did you go see the children?
Yes, I did.
All right. Did you treat them for their cold?
Yes, I made sure I took everything with me so that I didn't know the condition of the children, so I made sure I took everything with me to do lab work and throat cultures, so I took everything with me to assess children properly.
And you did that?
I did that, yes.
At some point during that meeting with the children, did you have occasion to speak to Michael Jackson?
Yes, I did.
Okay. And this is the first time you'd ever spoken to him.
Yes.
Did you talk to him about any problems he might be having?
No. What he said was to me is, what do you do? And I said, well, you have a concern about something? And he said, I've just been tired, a little tired. And I said, well, I do nutrition and nutritional therapies. And he said, well, can you start me on some therapies? And I said, well, yes, but I don't start anyone on any therapies until I do lab work first. And so I told him I can come back the next day. He would have to fast that night from 12 midnight to the next morning. And I would come back the next day and I would draw his blood to do lab work first.
Did you come back the next day?
I certainly did.
Okay. And what day was that?
That was February 1st
Okay. February 1. This was at his
of
house?
2009, yes.
Okay. And this was at his house as well?
Yes.
All right. Well, you came back, and now you were going to discuss with him any medical complaints, you're going to take some assessment of him, is that right?
Most definitely. If a
Okay.
person give me a vague symptom of I'm tired, then I want to rule out everything that possibly could cause that. You could be overworked. It could be many things that can cause tiredness. So that's why I said I need to do the lab work first.
All right. Now, in your assessment, what things did you do to make that assessment?
I did a physical exam. I did drew his blood, and I ordered certain panels to rule out anything that can cause a person to feel fatigued and tired.
Certain what now? Panels?
Blood tests.
Blood test. Okay.
Yes.
Okay. Did you also do an interview with him?
Oh, yes.
Okay. And part of that interview was that, did you ask him about medications he was taking?
Yes. And actually what is called not so much an interview as I did a history and physical.
Okay. And
Yes.
that helps you determine that maybe...
Exactly. Yes.
Member, got to wait. Please ask the whole
I'm
question.
sorry.
That's all right.
It helps you determine, what could be causing this fatigue or this tiredness.
Yes.
In your analysis, did you ask Michael Jackson about his sleep patterns?
Well, on February 1st of 2009, he wasn't really talking a lot about his sleep pattern.
But you did provide him a survey form, a symptom survey form,
Oh, yes.
right? Mm-hmm. And you provided him, you asked him other questions. Is
Yeah,
that
quite a
right?
few questions. I'm pretty thorough.
Yes. You have to be thorough, right?
Yes.
Okay.
Yes.
One of the things you said he complained of when you first spoke to him was tiredness. During your examination, subsequent examination, you talked about fatigue, easily fatigued.
Yes.
All right. And in fact, part of your analysis is you asked him to list the 5 main physical complaints.
Yes, I did.
And that's part of what you do in your thorough analysis.
That's on one of my forms, yes.
And he mentioned 3 of them,
Yes.
and one of them was fatigue.
Yes.
In this analysis, did he happen to tell you of any medicines he was taking for this fatigue?
No, I noticed when I was with him, he loved to drink Red Bull, and I told him that what can cause him to really, that all the caffeine can cause him to feel fatigue, especially after I got back his lab results. But I just went first to get a clear assessment.
Okay.
And the medication, no. He said occasionally he would just take Tylenol PM, and that's in my report.
And for insomnia. Did he say it was for insomnia?
He said he would take it sometime at night. He didn't take it for pain, so he said at night he would take it.
Okay. But clearly at this time, it didn't seem to strike you as a problem, any lack of sleep.
No, not February 1st of 2009. It did not seem to be a problem.
One of the questions that you asked on your health questionnaire was do you have difficulty falling asleep?
Mm-hmm.
And he did say he had difficulty doing that.
Yes.
Right? And that's just one of probably 200 questions you asked, right?
Yes.
I mean, so that didn't ring any. A lot of us have trouble falling asleep, right? I mean, that didn't ring any bells for you.
It did, because he was drinking Red Bull. And because he was drinking so many high caffeinated sodas, I felt during that time, until I received all his lab result, that could be one of his problems.
The Red Bulls.
Yes, high in caffeine that will keep you awake.
Okay. Did he happen to tell you when his fatigue normally set in? Did he give you any kind of time?
No, we didn't
Estimate
go
of
through
that?
it a lot then, because he said whatever I need to do nutritionally, just tell me, so that I can start having more energy and feeling better.
Okay. That was his main concern.
Yes.
Did it appear to you from just looking at him that he seemed fatigued?
No,
He didn't. Okay.
no. Well, he thought he was anemic. That's why I ran some of the blood tests. He said, I'm tired and maybe I'm anemic, so that's why I ran all the blood tests.
Did he at any time during this first meeting with you talk about possible tours he was going to go on?
Yes.
At the
Well,
very...
not in February 1st of 2009, no.
Okay. So not in the first meeting.
No.
Okay. But he did talk about training and concerts, losing water. He did-
Through the time I saw him, yes.
Okay. Can you tell us what he told you about that?
He said there's times that during rehearsal that he could sweat so much that he would lose 5-7 pounds sometime from just perspiration.
Did he tell you that he was rehearsing during that period of time?
Not the very first visit, but he did tell me consequently through the visits, yes.
What was your impression just from your initial consultation with him?
My impression was he was a very healthy person, a very loving person.
I mean medically.
Medically, he was very healthy. Vital signs were normal. He was very healthy.
Did you suspect any problems with him physically?
No.
Any nutritional problems?
Nutritional problems, I was waiting to determine when I received his lab results.
Okay. And you had drawn blood on the 1st of February, right?
Yes.
And you were going to send that out, get those lab reports?
Yes.
Okay. When did you send that out?
That went out when I went the same day. When I told him to fast and I went back the next day is when I drew his blood.
Okay, so it was the February 2nd you came back and withdrew his blood, right?
Yes.
Okay. And you, at that point, you told him Red Bull may be a problem, right?
Yes, and he said, whatever you tell me to do, I will stop.
All right.
I want to stay healthy.
All right. When did you next see Michael Jackson?
Let me look at my dates here. I saw him on February 3rd.
Very next day?
Mm-hmm.
Yes?
So,
Yes.
yes. So,
Sorry.
so 4 days in a row you saw him? And
Yes.
Was he doing better?
Well, I was still waiting for his lab results, and we started some nutritional, and he said he was feeling a lot better, yes.
When did you get your lab results? Or his lab results?
I received his lab results on the 5th.
Of February.
Yes.
And when did you next see Michael Jackson?
On the 3rd, on March 3rd.
So 5 days in a row. Fifth day in a row?
No,
March 3rd.
March. Okay. What about
I'm
February?
sorry, March 9th.
That was the next time you saw him? When, is that the first time you went over his blood results? Was
Well,
March?
you asked me when did I receive his lab results. I received his lab results back in February on the 5th. I
Okay.
received them.
And when did you next see Michael Jackson?
On March 9th,
Okay. So a month later?
yes.
Is that the very first time that you went over his lab results was March 9th?
Yes.
All right. And from February...
Let me make sure I'm clear with.
Okay, yes. Is it possible you saw him a few times before then? You want to take a look?
So on February 27th, I actually drew blood again because I wanted to see the treatment plan that he was on, how effective it had been. So it was very effective, and he was doing a lot better.
All right, and what treatment plan did you have him on?
I actually provide him with a very high concentrated smoothies that I was going in the mornings. That's why the visits were kind of close together. So he said he didn't really know how to make them, so I said I would come and make them for you. So it's a wonderful kind of sports, high-protein smoothie full of nutrition, and it's actually in my report exactly what it is and what was in it. I gave him a B12 shot, could you repeat your question again, please?
Okay, what was your treatment to help with his fatigue?
Okay.
You said smoothies, and you
Yeah,
talked about
and
B12.
it wasn't just a smoothie. This was a really sophisticated nutraceutical product that had all the nutrition in it that really helped with energy. I've used it with a lot of people in the past.
What about IVs?
His his nutritional IVs, I started him with that also. There's his initial blood work, because he had mentioned he would like to have, because I told him about the nutritional services that I provide, and one being a nutritional IV. And I said, well, it's the only way I can do that when I do your lab work, which was on the initial visit, and there's a certain blood test that a person have to have before this test or treatment is given. So I actually did his lab work, and before anyone received nutritional type of IVs, there's a blood test we have to do, and his came back normal. So I started him on very low doses of vitamin C IV therapy.
On March 3rd, 2009, did you provide him an IV?